Hello and welcome to my channel. This is Dr. Dawn Michael, and today we're going to discuss anorgasmia. So we're going to talk about this in clinical terms, and I'm also going to give some statistics and how a person who is not able to have an orgasm may be able to resolve this problem, and why this can happen, and if it is a medical problem or more of a psychological problem. And there's different types of anorgasmia, meaning that somebody may not have ever had an orgasm in their life, or perhaps they've had one and it stopped. It could be that it's situational, or it could be that it's health related. So we'll get into the nitty-gritty of that and break it apart. So if you or your partner has ever had this problem, this could be a very helpful video for you to watch today. So first, let's really talk about what anorgasmia is. So it's listed as a type of sexual dysfunction in which a person cannot achieve an orgasm despite adequate sexual stimulation. In males, it most closely is associated with delayed ejaculation or no ejaculation at all. And it can cause, obviously, sexual frustration in the person who is experiencing it, and as well as with their spouse or partner. So anorgasmia is far more common in females, 4.7%, than in males, and especially rare in younger men. Although I have seen as of lately that some men are having more problems with this, and that could be due to either overstimulation of the mind, overstimulation of the genitals. It could be due to alcohol, as well as extensive marijuana use can have a problem. And of course, one of the main problems is if someone is on an SSRI, which is an antidepressant medication, that can definitely affect if a person is able to achieve orgasm and the amount of time it may take them to do it. But let's talk about some of the causes. Okay, I'm going to go over this. And we're not going to talk about right now the psychological causes. We're going to mostly talk about what are some of the medical causes. So I'll go through that pretty quickly here. So the medical causes may be if you have diabetes, it could be diabetic neuropathy, multiple sclerosis, genital mutilation, complications from that as well, pelvic trauma, such as an injury from falling or something where you've fallen on your pelvis, hormonal imbalances, a total hysterectomy, spinal cord injury, childbirth trauma, and cardiovascular disease, to name a few. So these are all medical problems that can relate to not being able to have an orgasm or delaying the orgasm, or also involve painful orgasm, and that could result from these as well. So now we're going to move on to the drug-induced problems with having an orgasm. And as I stated before, there's many antidepressant medications that can create a problem, especially for men with delayed ejaculation or women not able to have an orgasm at all. Now, you have to weigh the cost and benefits of this because they have come out with new antidepressant medications, and some of them don't have a side effect, but others do. But sometimes the ones that don't have a side effect don't work as well. So this is something that you definitely need to talk to your doctor about and kind of figure out what works best for you in your situation. The other problem is opiate addiction. So that would be a big problem in taking painkillers and for an extended period of time. And of course, heroin can cause delayed ejaculation or not having an orgasm at all. About 15% of women report difficulties with orgasms, and as many as 10% of women in the United States have never climaxed. Only 29% of women always have orgasms with their partners. And again, those statistics vary depending on the age of the woman too. So, primary anorgasmia is a condition where one has never experienced an orgasm at all in their life. And again, that can be due to medical, or it could be emotional, physical, and it could even be to a belief system. So there's a lot of reasons that somebody may not ever have an orgasm besides it being health related. So the secondary anorgasmia would be that you have had orgasms in the past, but now you do not have the ability to have an orgasm. This can be very frustrating if you were able to have them, and either because you've had a medical problem or you've suffered some trauma, some illness. Some women go through menopause, if you were sexually abused. These are all things that can have an effect on having an orgasm again. And definitely if it is a secondary anorgasmia and it's not medical, many people can work through this through counseling and be able to have an orgasm once again. Then there's situational anorgasmia, and I work with a lot of people that fall into this category. And usually it's because they are not in a relationship where they are feeling the desire to have an orgasm. And it depends on the situation or the person they may be in the relationship with, or they may not be feeling as desirous as before. And a lot of this is that as we get older, our bodies change, our minds change, and we need to use different types of stimulation. So if it's a matter of using lubricant, maybe trying to learn your body. So if somebody is not feeling the same way, they may want to try to masturbate and figure out a new way of having an orgasm. Sometimes you can use a vibrator to get yourself started, or different stimulation, different pattern. Again, lubrication is very important if you're feeling dry. Sometimes it can be a hormonal imbalance, and that can be fixed if you go to the doctor and get a blood test and get your hormones checked. So let me go over now. Basically it says a diagnosis, so the treatment depends on the case of it, and that is definitely true. So one other problem can be if, for a man, for instance, if he has had any prostate cancer, and that would be working with the doctor to rehabilitate him so that he is able to have an orgasm. And it doesn't necessarily mean that he has to have a full erection to have an orgasm. He still may be able to have one without an erection. But if you are a person who has never had an orgasm, or you are having problems having an orgasm, it doesn't necessarily mean that you can't enjoy having sex or being touched or being intimate. Sometimes an orgasm does not always take place when you're in a sexual situation, and as that can be frustrating for yourself or for your partner, it certainly doesn't mean that you can't find enjoyment or pleasure from it. So sometimes you have to adjust your expectations. Of course, if you make it that your goal is to have the orgasm and you're not having it, that can become even more frustrating because you're also putting pressure on yourself. And anytime you do that, you're creating anxiety, and that impedes blood flow. Anytime that you feel super anxious about something, many times your body will go into the fight or flight mode, and the blood that's supposed to go to your genitals actually will not go there, and therefore you're not able to go through the process of being properly aroused. And so you really want to be able to keep the expectation low and the anxiety low, and make it a pleasant situation where you can feel pleasure but without the pressure or without the anxiety. And that can really help with somebody who has never had an orgasm and is struggling with the idea that they're never going to have one. In many cases, if it's not a medical issue, most people are able to have an orgasm. And it just takes time. It takes it takes some time to understand your body. For many women, more so than men, the reason that they're not having an orgasm is that they are not taking the time to get their mind stimulated first and to relax and not to push the orgasm. And you don't want to rely on your partner in the beginning to have them give you the orgasm, because they don't know your body better than you know your body. You are the master of your own body. You are the master of your sex life. So when you get into a situation and you've never had an orgasm, the best thing to do is to teach yourself how to have one first, and then you can show the person you're with how you like to have an orgasm, because everybody is certainly different. Nobody orgasms the same way. Everybody's body is different. Everybody's mind is different. So their orgasm is unique to them. And on this note, as people get older, they also will question, well, do I have to have an orgasm every time? If I'm not having one, does that mean that there's something wrong with me? And with that being said, no, that doesn't mean that there's something wrong with you. But certainly if you're getting to the point where you're getting engorged or you're getting frustrated, that is not healthy either. And so you would need to deal with that part of it. So today I just wanted to share with you, what anorgasmia is and some of the challenges that people have, why it may happen, and how you can move forward and get help if you feel like you need help, and give yourself some understanding or some time to explore your own body if you want to try to become orgasmic. And also, if you are in a relationship and you want to have an orgasm but you're not and you're frustrated, taking the time to work with your partner and not pushing it but relaxing, because if you try to push an orgasm, chances are it's not going to happen. You can't force an orgasm. It's something that takes time, understanding, relaxation. And in many of my other videos, I have some videos on breathing techniques, ways to calm the central nervous system down, to relax, to not put pressure on yourself. And so it would be helpful for those of you that fall into that category to go back and look through some of the videos and get some information on that. If you have any further questions, you can visit my website. I do have a place there where you can email a question for a small fee, and I do have appointments available. If somebody needs to make an appointment, you can again go to my website and contact me. My website is thehappyspouse.com. So if you like this video, please give me a thumbs up and subscribe to my channel, and of course, leave a comment. I believe everyone deserves to have a healthy sex life, and so do you.